It began in central China, a new respiratory virus similar to the flu, but more dangerous and more contagious. In those early days, we heard reports of overwhelmed hospitals and a government cover-up. But before long, the virus wasn't just in far-off Wuhan. It was on planes, on ships, and then it was here in Europe. Case numbers surged in Italy, then Spain, and it quickly became clear that no continent, country or city could be safe from COVID-19.
The virus is spreading in all member states.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
To keep new cases from entering our shores, we will be suspending all travel from Europe.
Soaring infections began pushing hospitals to their limits. Thousands of vulnerable patients and not enough ventilators to go around. Health workers short of protective equipment, working in fear of getting sick.
We're risking our lives, so having to do it even more so because we don't have the right equipment.
I'm scared that we're going to run out of PPE. It's just not my hospital. This is a concern nationwide.
And in UK, a virus scare at the highest level of politics.
I've developed mild symptoms of the coronavirus.
The Prime Minister's condition worsened, and on the advice of the medical team, he was moved in to a critical care unit.
The virus has forced billions into lockdown and brought thriving economies to a standstill.
Global GDP will fall even further by an additional 3% in 2020.
Europe is particularly hard hit. Growth projections for next year are grim.
Trillions have been poured into a financial recovery, but international divisions have been laid bare as governments look to protect their own citizens and their interests.
Of course, there are still some who want to point fingers and deflect blame, and there are others who would rather talk like populists than tell unpopular truth. To this I say, stop it.
There are now more than 1 million cases across Europe and no end to the pandemic in sight. Questions remain about the nature of this virus and how soon it can be stopped. Hello and welcome to this special programme. Well, you've been asking questions. We're going to try to get you some answers. For the next half hour, we'll be speaking with two experts who are working in turn to turn the tide on this pandemic. Now, Dr. Suerie Moon is the co-director of the Global Health Centre in Geneva, and Professor Luke O'Neill is an immunologist and head of the Inflammation Research Group at Trinity College in Dublin. Well, good afternoon to both of you. Now, I'd like to ask you both the same question, but I'll start with you, Professor Neil. We're a bit more than 100 days now since the World Health Organization was first alerted to the existence of COVID-19. So how do you gauge our understanding so far of COVID-19?
It's been amazing, and really the amount of science that's gone into this virus is unprecedented. We have a huge amount of knowledge about various aspects. We know what the virus is, we know how it spreads. You know, many different scientific questions are known. Of course, there's many unknowns, but again, science is working very hard to try and answer some of those unknowns as well.
OK, and Dr. Moon, so there has been a certain lack of communication amongst the scientific community that may have hampered progress, but how well do you ascertain our knowledge of this virus of COVID-19?
I think the scientific progress has been really impressive over the last 3 months. It's moved ahead in really a record time, but there's still a huge number of questions that we really don't understand. Neil has already mentioned. For example, one of the questions we have is regarding the possibility of getting reinfected, or how long somebody who's recovered from the infection might actually be immune and remain immune to the disease. So lots and lots of questions that still need to be answered.
A lot of questions that need to be answered. And obviously, these are questions we're going to be bringing to both of you throughout this next half hour. But in the meantime, we are seeing lockdowns ease in some parts of Europe. Elsewhere, they're getting longer. And that's prompted Tanya Robinson on Facebook to ask, when is it safe to ease a lockdown? Do we actually have any precedent when it's OK to actually do so? Well, Alex, you have been looking into that, haven't you? Bring us up to date.
Well, Isabel, if I might tell this in a story of two cities, if I might. Austria. This week in Vienna, we saw shops reopening, but in Paris, the lockdown got longer. This really is the dual picture we're seeing in Europe. We saw Austria joining alongside Spain, some regions of Italy, in easing some of their restrictions, while France, Belgium and the UK extended their lockdowns. In France, it was another month. And indeed, they were sticking with the rather stringent control measures. So why is there this dual picture? And what exactly is it like to live in these parts of Europe? Well, let me start off by showing you Vienna. This is Vienna, the day that shops were allowed to reopen. This is a hardware store. Now, in France, it's almost unimaginable to see queues like this. Unthinkable to think you could pop in for some DIY. This is one of the biggest hardware stores. Apparently, there was a queue around the block. Life there returning to a semblance of normality. But then let me show you Paris, if I might. This video sent to us by Jessica. She's been living there for a few years. This is her filling out a form, justifying not only where she's going, but for how long, and that it will not be more than 1 kilometre away from her house. Now, she sent us a little video explaining what it's like still living there.
Either before 10 a.m. or after 7 p.m. And when you do go out, it can't be for longer than an hour or further than 1 kilometre from your home.
So that's one perspective. What about Austria then? Is life going back to normal on the other side? Well, actually, Cecilia is one of those who lives in Vienna, and she sent me a video explaining that even though the shops are open, a lot of people staying home. This is what she said to us.
To a shoe shop to pick up some socks, and the lady in there said that people still seem pretty nervous about going into the shop, and they've only had 2 or 3 customers this morning. Everyone has to wear a mask. That shop's a bit bigger, so they were allowed 13 people in at any one time. At the moment, that's not a problem, but if more people want to go in, they said they'll have to start standing at the door.
So those are 2 videos sent to us here, Isabel, giving a picture of life under 2 very different forms of the lockdown now. So I suppose a lot of the questions are, why are things different in Austria, Denmark, these kind of countries, but why are things getting longer in others?
Really stark differences, aren't they, Alex? Here, for example, when we go to work, we actually have to fill out a separate form to justify the fact that we're going to work here at Euronews. Well, let's pose some more questions now to our experts. And I'd like to begin with you, Suerie, because it does seem a bit of a gamble. When we hear what Alex was just saying there about different measures in terms of lockdowns, is this not a gamble with people's lives when some governments decide it's OK to ease restrictions when we don't really have full knowledge of what this virus will do?
I think it's certainly true to say that governments are all engaging in massive experiments. Nobody has all the answers on what's the perfect timing and what is the best way to lift lockdown conditions. But we do know, and where there is a consensus that's emerging among the scientific community, is that there are a number of conditions that all countries have to be considering. One is how do you put out the fire that's burning? We have to get the forest fire to come down to basically embers. We have to get the epidemic under control. 2, how well can we track what's happening afterwards? And this has to do with the testing capacity that a country has in place. 3, how well are the hospitals functioning? Are we still overburdened in the hospitals, or is there room to take on new patients if, again, we have a flare-up? And then finally, can we identify new cases? Can we isolate them? Can we trace contacts? And then put people in quarantine so that there isn't a second wave of infection as countries slowly begin to relax their lockdown conditions. Every country is different. Every government has to assess these conditions for itself. And so on the one hand, it's understandable that countries are taking different approaches. On the other hand, it's a huge experiment, and we're all watching different countries to see who's figuring it out and who's making big mistakes.
OK, well, Suerie, you've actually queued up my next question perfectly here for Luke. And this is a question that comes from Sophie Merchandani. Now, she sent us this question on Facebook. And she says, which country in the EU has the best strategy and preparedness for testing and contact tracing? And would it make sense for others to actually follow suit?
Sure, Isabel. Iceland are top of the class, by the way. They began testing very quickly and extensively. So we like Iceland because they're very effective. Germany has done a fantastic job as well. They got in very early. They got Roche, the Swiss pharma company, who are great with diagnostics, by the way. They began doing all the testing for Germany. They're 2 countries that really stand out as doing a great job. There's a league table, of course. You can see this, which country's doing well and which isn't. And it's very mixed in truth. Some countries aren't testing enough. And there's been a problem, of course, getting enough test kits in, getting enough so-called reagent in to measure these things. So it has been a challenge for some countries.
Yeah, but look, the testing is one thing, but when we consider these lockdowns, what about the issue of being infected a second time? This was a question from Trudy Hamer, again on Facebook, and she says, do we know if people can be infected more than once?
Yeah, that's the really important question. Now, the answer is we don't fully know is the truth. But there's good evidence that we're probably protected if you've been infected. For example, there was experiments done in monkeys who they infected with the virus and then tried to reinfect them. They couldn't. Secondly, we know we make a big antibody response to this virus. Loads of antibodies are churning in your system. They are the virus busters, by the way. And if you carry those antibodies, that means you've had the virus and now you're no longer infectious. So there's good evidence that you should see protection. The question is, how long will that protection last? And people who work on other coronaviruses say about a year maybe, which is good. If you do get a second infection, it's much milder. But we don't fully know. It's a new virus. But still, there's optimism that if you're infected once, you should be protected.
And Suerie, we were hearing all these new terms that you're probably obviously very aware with, but for us lay people, this is all very new. We hear now viral load bandied about quite a lot. And this was a question from a group called Rights World on Instagram, and they're kind of asking, how does this viral load work? And they give an example of being in a hospital. And they said, if a lot of people have COVID-19 in a hospital, does this not increase the viral load and then put these patients probably more at risk?
There are a group of researchers who are looking into this, and there's a fear that greater exposure to a greater volume of virus actually can make you more severely ill. I would say this is one of the questions that definitely needs more research, and it's one of the questions that for which there's a lot of scientific uncertainty that remains. But when we see, for example, the number of healthcare workers who are becoming severely ill, who are dying at a young age, despite the fact that they don't have underlying health conditions, it does certainly raise a lot of concerns and questions over how much virus are people being exposed to, and to what extent does that not only increase your risk of becoming sick at all, but increase your risk of becoming very, very severely ill.
OK, we're going to be back to you two just in a few moments. But now we're going to turn to some of the questions about treatments and possible vaccines. And one treatment that has really been hitting the headlines is hydroxychloroquine. And that is something Alex has been looking into because there's a lot of controversy there.
Well, indeed, Isabel, on Facebook, Danjan has just been asking in our live stream, of course, you can join the conversation at any time, asking what medications have been proven to be effective. Now, this is a very complicated question, not least because the novel coronavirus, let's not forget, did come sort of out of nowhere when it comes to medical research. What normally would take years to develop in terms of a vaccine, people are trying to push for in a real short time. So we're seeing leaders around the world, I think it's fair to say, grasping onto whatever they can that offers some hope. Now, one of the drugs that has been touted is something called hydroxychloroquine. Now, that is a decades-old malaria drug, so is chloroquine, that is also used in cases like rheumatoid arthritis and lupus. Where is the link with COVID-19? Well, there is a suggestion, anecdotal evidence at this stage, that the drug could have some benefit for patients with the novel coronavirus. The US president seizing on that, and in tweets like this one saying it could well be a game changer. We also know in France that President Emmanuel Macron ordering clinical trials to really kick up a pace to look into this drug. So what exactly is it and what is the evidence? Well, it's certainly not a cure. There is no evidence that this is a cure. What instead we are seeing is doctors around the world, including in hospitals in New York and here in France, experimenting, I think it's fair to say, trying to see whether this drug has any effect. We do not yet have large clinical studies on this matter, and the possible side effects, well, some of them are to do with the heart. There's concerns about people's hearts, but we do not yet know. So when we're looking at questions like that from Danjan, I think it's fair to say there's a rather mixed picture. So let's put this to our two experts joining us. Well, can I just start by asking you, Professor, what is the view, your view on hydroxychloroquine, chloroquine, some of these other drugs that have been touted as a possible game changer here?
Yeah, hydroxychloroquine is interesting because it was shown to have effects against the virus in a test tube, say. There was evidence with other viruses that hydroxychloroquine might work, and that justified these trials. We've got to be very, very careful, though, because there's no doubt it damages the heart in a small number of patients. Now, the problem is COVID-19 is heart damaging as well. So the worry we have there is it's a double whammy. If you give hydroxychloroquine to someone and they've already got heart problems, there's a risk it might make it worse. So the trials are progressing very, very carefully. Secondly, there's still no evidence that it works, by the way, no compelling evidence. We've got to wait for these trials and then we'll know.
So, you know, in your view, what should doctors be doing? Because obviously doctors with patients, and we're seeing obviously in heartbreaking situations in Italy and Spain, now in America, doctors really grasping for what they can. Would your advice be to them to hold off or, where possible, to try drugs like this?
Some doctors like it and they are trying it off-label. As you said, it's available for lupus and arthritis anyway, and they're trying it. They're in desperate measures to try and help their patients, I guess. But I would urge caution with hydroxychloroquine until those trials are done. A second drug that's potentially more promising is an antiviral drug called Remdesivir. This kills the virus on contact. It's made by a company called Gilead, and at the moment that's going through trials as well. And there's little hints it might actually work. That would be a huge benefit, because here we have a drug to kill the virus in your body. It's marvelous. That's how we treat HIV, for instance. We use drugs to kill HIV directly. And we're waiting now for these trials to read out. In the next 3 or 4 weeks, that's the key window now. Some of these medicines, the results will begin to emerge, and we're all keeping our fingers firmly crossed.
OK, in the next 3 or 4 weeks, now this isn't a very long amount of time. So, Suerie, can I just ask you, is there any concern, I suppose, in terms of safety as these measures, which would usually take a very long time indeed, are speeded up at exponential rates?
I think there are concerns about safety on a couple levels. One is, of course, some patients have very toxic reactions to hydroxychloroquine or other drugs, so we have to be quite cautious. And it's normal that in a pandemic, especially with the new virus, there's a lot of panic, and doctors and nurses are faced with very, very difficult decisions every day on what can we do to help our patients. So it's understandable that we're throwing the medicine chest at patients in some ways, but we really have to be quite cautious and let the trials answer the questions in a definitive way. We have about 600 clinical trials taking place right now worldwide. And certainly some of the early results that we expect to see in the next month or so are going to be, I think, hopefully offer us some directions forward. To me, one of the key questions that we need to think about is who is going to get access to these medicines once we do have clear evidence as to which ones work. And we've seen that a number of governments, for example, have put in place export restrictions. The countries that have the capacity to manufacture the medicines will most likely make sure that their own people are served first. And today we have a huge concentration globally in the way that medicines are manufactured. It's really only in a handful of countries that we have large-scale medicines manufacturing. And so the question of how do we make sure that effective drugs reach everybody who needs them across all countries without bankrupting health systems, I mean, this is a huge, huge issue that we've not made enough progress in addressing.
Well, Suerie, I'd like to now pose this question to you, Luke, because how can we ensure that everybody gets access to these treatments, to these vaccines, when we are looking at an absolutely enormous global effort that will be required?
Exactly, yeah. Now, we know that if some of these work, I mean, everybody's worried about this, because if a given drug works, how do we get it out there into the community? And every drug company is worrying about this as well. So one example would be Johnson & Johnson are doing a big vaccine trial. They've said they'll make that vaccine available all over the world. They're going to start making it in bulk, you see. Now, can they do that? We don't know. But obviously, if a drug or a vaccine or the therapy is working, you've got to ramp up production and get there as soon as you can, basically. So it's very much in people's minds. And there are plans in place, by the way, to try and address this supply and demand issue.
OK, supply and demand. Now, we have a question here on Instagram, and this is specifically about vaccines. And this is from Nuridino Vecchio, and he's asking, when will a vaccine be made available? And then I guess the follow-up question, because what you have been just explaining to us, when will it be made available globally to everybody, so everybody can have access to this? Suerie, sorry.
Yeah, well, again, oh, sorry.
It's not realistic that we're going to have any vaccines that have been fully tested and approved until next year, until 2021. People estimate at least 12, possibly 18 months to have regulatory approval of a vaccine, which is not the same thing as saying that it's been manufactured, that it's being made available in different countries around the world. And so what we see is being put into place right now are plans to invest today in vaccine manufacturing capacities with the understanding that the demand really is going to be worldwide. This is really unprecedented. I have to emphasize that we have never before had a pandemic that has spread so quickly to the entire world that everybody needs access to the drugs and the vaccines at the same time. I do think that we're going to be in slightly better shape with vaccines, but because we have some lead time. We have about a year to put in place all of these measures, the intellectual property licensing agreement, the manufacturing, the tech transfer, all of that, which needs to be done for vaccines. Right now, I'm actually more worried about medicines, because we're going to see evidence coming out in the next few weeks. And the scramble for drugs is going to be instant. We don't have the measures in place, neither to ramp up production, neither to get over export bans, neither to make sure that especially some of the developing countries, some of the poorer countries that are now beginning to reach that exponential part of the epidemic curve, but don't necessarily have the money to compete as buyers with some of the richer countries, we're going to see countries really being left behind in the scramble for drugs.
OK, so this is really going to expose once again the divisions between rich and poor. There's also, again, which we've been highlighting, is that how little we understand about this virus. Now, we may be talking about a vaccine here for what we understand as a respiratory illness. And Luke, I'd like to ask you this question, because we're seeing growing anecdotal evidence, probably from the scientific community. You're more well aware of this. But this isn't only a respiratory illness. We're seeing people suffer from kidney failure, have cardiac problems, neurological problems. So really, what is the expanse of COVID-19?
I hate to use a Trump word, but it's a nasty virus. There's no question this is very nasty. And the receptor for the virus is called ACE2. That's the thing the virus locks onto with its spike to get inside cells. That is in your lungs, it's in your gut, it's in your heart. It may even be in your brain. The stuff recently saying there may be brain effects. So it's not just about the lungs, absolutely. But people mainly die, though, of respiratory failure. It lives really deeply in your lungs. That's its main place, I guess. And then the lungs become inflamed and become very damaged, and you get respiratory problems, and sadly you die. These other ones are more symptomatic, we think, although there could be a cause of death in these other tissues as well. But the main cause of death at the moment is a lung problem.
OK, well, we are getting a lot of questions in live. We received many questions here on our social media pages. Well, Alex is monitoring what we're receiving live. Alex, bring us in some of the questions you've been getting.
Well, absolutely. There's a lot of focus, I think it's fair to say, from those of you joining us on Facebook. Questions about medications. We've talked about the medications that have been touted as possible cures and treatments. But then there's also a question I want to bring you, which I think is a really interesting one here. And that is, from Lena here. She's saying, what medicine should be taken at home if you have mild symptoms? Now, if you do develop COVID-19, but you are perhaps a severe case, the recommendation is to self-isolate at home, keep yourself away from people, and to rest and recover. We know many people do have mild symptoms. So if I might just ask Dr. Suerie Moon here on this exact point, if you do have mild symptoms yourself, what kind of medications, what kind of treatment should you administer to yourself?
I think this is something that I'm going to have to refer to Professor O'Neill. It's certainly not my area of expertise, so I'm going to... Well,
that sounds good then. All right, Professor O'Neill, what would you recommend?
I can help. Well, there's no cure. There's nothing obvious. You take paracetamol if you have a temperature, because a fever is a key feature. Paracetamol is a pretty safe drug. It works very well to bring down your temperature, and it can help with some of the aches and pains and, you know, the typical flu-like symptoms. There's nothing else really. Stay well hydrated. It's very important because your immune system uses a lot of water, interestingly, so you got to keep hydrated to keep the immune system going. And all you can do is mind your own immune system, and that means try and get a good night's sleep, try and take some exercise and have a good diet, and try and de-stress, because that really damages our immune response. So your best bet is a healthy lifestyle, a bit of paracetamol. That's all you can really take. There's many quack things out there. Take none of them at all, right? That's my advice, because there's no evidence behind them at all.
OK, now I would like to bring in you then, Suerie, because we've been talking about some of the kind of very scientific experimentation that has been done when it comes to COVID-19, but there's also some very simple measures, and that is wearing masks. And that's a question that's come up again and again, hasn't it? Because there's just no certainty for us anyway, as lay people, whether a mask is effective or not. And this question came from Jack Vacados, and he asked us via Instagram, does a mask protect when walking, cycling, or moving about outdoors?
Yeah, I think this is a great question, and a lot of governments are really struggling right now to figure out what is the guidance that they should be giving their own citizens. And the evidence base is really quite limited. It's based on a number of experiments that were done, of course, before the coronavirus outbreak began. There does seem to be some limited protection that individuals would get out and about from wearing masks. It seems to be more important in closed settings, such as at the grocery store and the pharmacy. This is very different from a healthcare setting like a hospital or a clinic, of course. But the primary purpose really of wearing masks is to protect everybody else, so that if you are sick, and of course many of us don't know if we're carrying the coronavirus because there's a high proportion of people who don't have any symptoms or have very, very mild symptoms. But if you don't know and you're wearing a mask, you will prevent the amount of virus basically that you are putting into the atmosphere. So there is a hypothesis, and I really emphasize this as a hypothesis, that in Asian countries where it is more customary, where the general public is used to wearing masks all the time. The fact that many, many people have been wearing masks has helped a number of Asian countries get this epidemic under control. But a lot of countries are really, again, they're experimenting. We're all watching each other very closely to see what seems to make a difference and what doesn't. There is a little bit of concern that certainly if many people rush out and get masks and there are shortages for healthcare workers, we're going to make those shortages worse. I shouldn't say that's a small concern, that's a major concern. There's another concern that if you touch the mask and you touch your face and you don't know how to use it properly, you're actually going to increase your risk. So it's not a black and white issue. I think this is one of the reasons why everybody is really wrestling with what do we recommend for our own people.
So many questions there about recommendations. I really want to thank you both so much. When we start this program, when we finish it, we realize we have many more questions than when we even began. But thank you very, very much, Professor Luke O'Neill and Dr. Suerie Moon. And thank you so much for joining us today on this special question and answer session. We leave you with a no comment from space, where a crew of 3 returned from the International Space Station and made a safe landing in Kazakhstan.
And Jessica Meir, board engineer 1 and on the left seat of the vehicle, makes her way into the Soyuz MS-15 spacecraft.
Anatoly Ivanishин continued. I did not see any FOD.